What is the history of antibiotics for UTIs? Imagine a time when urinary tract infections were a mystery, and people relied on herbal teas or even urine itself to try to ease symptoms. For thousands of years, ancient civilizations like the Egyptians described urinary issues, but they didn't understand the bacterial cause. Treatments were mostly about comfort, not cure, and outcomes varied widely. Some people recovered, but others faced serious complications or repeated infections that could be life-threatening. The breakthrough came in the early 20th century with the discovery of antibiotics. The first effective antibiotic for urinary tract infections was nitrofurantoin, introduced in the 1950s. This was a game-changer because it allowed doctors to quickly and reliably cure infections that once posed serious health risks. As antibiotics like amoxicillin became widely used in the 1970s, treatment success rates improved even more. However, this also led to a new challenge. Bacteria started developing resistance to these drugs, making some infections harder to treat. Today, treatment for uncomplicated urinary tract infections usually involves short courses of antibiotics, often lasting 3 to 5 days. For people with frequent infections, doctors might recommend low-dose antibiotics over a longer period to prevent recurrences. But antibiotic resistance is a growing concern, so healthcare providers now carefully choose antibiotics based on local resistance patterns and individual patient history. In cases where standard antibiotics don't work, newer drugs or alternative options are considered. It's important to remember that most urinary tract infections are not related to bladder cancer. Still, recurrent or complicated infections might require more detailed evaluation to rule out underlying issues, including bladder abnormalities or cancer. Good bladder health practices, like staying well hydrated, urinating regularly, and maintaining good hygiene, can help prevent infections but are not substitutes for medical treatment when needed. Antibiotics have truly transformed how we manage urinary tract infections, turning what was once a potentially dangerous condition into a treatable one. Still, their use must be balanced carefully to avoid contributing to resistance. Always consult a healthcare professional for proper diagnosis and treatment. For those with bladder health concerns or bladder cancer, working closely with your medical team ensures that infections are managed safely and effectively within your overall health plan.